Welcome back, ladies and gentlemen. Now you saw how we did the hot and colds to the feet. We talked about how you could do it to the hips and how you can do it to the hands. How do you do it to the back, or how do you do it to the chest? So now I'm going to show you how you can do it to the chest. Now there's a couple of ways you can do this. You can wet a towel, wring it out, roll it up, and you can heat it up in a microwave, but I'm not very microwave savvy. So I'm going to show you the old way, and that is to dip towels into very, very hot water, and we're going to lay it. We're just going to pretend that Joshua has a very severe chest infection. In fact, it can be pneumonia, it can be bronchitis, it can be asthma, whatever it is. And the type of water we're going to use is the water in a gas state. It is steam. Now what I'm dealing with here is boiling water, which gives off steam. Now there are certain things that you can do, which I will show you, so that you will never burn. It's all right, Joshua, I've never burnt anyone. And so I'm going to be applying steam to his chest, but I'm going to be doing it in a way that it will not burn his skin. So there are some basic procedures that you can do to do this. So we're going to endeavour to do 3 minutes hot, 30 seconds ice cold. I've got a nice big lump of ice in this one here. But it's all right, I will not apply it to Joshua until he's nice and warm. Because we're warm-blooded creatures, you always begin with the hot and you always end with the cold. Now what I have here is I have Joshua's feet in a bucket of hot water, and for the whole procedure, which will be about 15 minutes, his feet will be in hot water. I have a kettle of boiling water there, and every now and then I will check that to make sure it keeps its heat. So one of the things you do to prevent burning the skin is you put a dry towel there. So I'm going to begin by putting the dry hand towel there. So there's my dry hand towel. So Joshua, I'll just get you to take your shirt off. One of the little boys asked if I could do it to him. I said his chest's not big enough. So you see I've got a dry towel down there. And I'm just going to wrap the rest of Joshua up. So you can see his towel there. And I've got boiling water here. And we found it hard to get some nice thin towels, because everyone's towels are nice and thick nowadays. And you fold it like this. This is a nice old one. You might have to go to the second-hand shop and get some nice old thin towels. And you twist it, and you dip it into the boiling water. And you leave the ends out so that you can twist it. And when you twist it, you can get all the water out. I lived in a rainforest for 12 years, and I learnt this method from books. And they're old books, and this is the old way of doing it. And by twisting it, you can get all the water out, but my hands aren't burnt because I've got the dry end. Just as well I do my push-ups, eh? Yeah. Now that will remain hot for quite a while. In fact, it's boiling hot. And I'm just going to get another towel here. So what you can do, and remember that's keeping its heat, and then I very quickly let it come out, very quickly. And I'm just going to make it into a pack about the size of Joshua's chest, which will be about that. It's hot. And I can wrap it up, and then I can walk over to my treatment room where Joshua is, and I pull this out and I lay it on, and then I cover him up. And then I'm going to talk to Joshua. I've got a nice little piece of wool here, and the wool will keep it. Now Joshua, how is it?
Very hot.
Too hot?
Yep.
Okay, so what I do now is I lift the towel up and I wipe the moisture off his chest. and it's the moisture on the chest that may burn. And then I come back down and I say to Joshua, how's things?
Very hot still.
Very hot. We come up again, and he will never burn if I do this. And I just use my hand to wipe that moisture off. And this is Joshua's first one, so it's going to take a few times. How is it, Joshua?
Still quite hot.
Still too hot? And I said to Joshua, you must tell me. You're not allowed to be brave. And I'm just taking the moisture off the skin. It's the moisture on the skin. It's the steam that penetrates very deep. How's that, Joshua?
Better.
Better?
Yeah.
Bitter. Sorry, it's New Zealand. Okay, and I washed Joshua carefully, and I talked to Joshua this morning. How's that?
Getting hotter now.
Too hot?
Yeah.
Okay, too hot. We wipe it again. You've got to work with the person. I can assure you that after I've done a cold washer on Joshua, he will be able to handle more. Okay, so I just, see, you just wipe that moisture off the skin. It's the moisture on the skin that may burn. How's that?
Yeah, it's fine.
Oh, that's fine. That's good. That's good. So we're looking at about 3 minutes. Never let the air get to any wet bit, because that will chill it. But this dilates the bronchioles. Now, when my son had asthma, the doctor told me I had to put my son on Ventolin to dilate the bronchioles. But then I discovered that Ventolin reduces lung capacity. How is it?
Too hot now.
Too hot? That's fine. I take it off. You will find that in the second and third, I won't have to do it this much, but it's quite fine. You've got to work with your patient. But this brings incredible relief to a congested chest, because the steam, how's that?
Yeah, it's fine.
The steam penetrates through the chest wall, penetrates right in and just opens those bronchioles. Mm-hmm.
So you said the Ventolin reduces lung capacity. Is that permanent or just while you're on?
Eventually it will be permanent. And so this is what drove me to find alternatives for my son, who was only 14, 18 months old. He had severe asthma. How's that?
Yeah, it's fine.
See, he's handling it now. Had severe asthma to the point that from his ears to his hip, his whole body, every breath would be like this, and his nostrils would flare with every breath. Oh, it was scary. That's why I took him to hospital. But I noted that really what they were doing in hospital wasn't doing much. All right? And then to discover that Ventolin reduces lung capacity, I thought, oh, I've got to do something else here. And then I went to a naturopath, and they told me about the hot and cold compresses. I had to take Peter off all wheat. We're having a little bit of dairy at that stage. Peter's 31 now. Actually 32, just turned 32. And then, all right? And then, so I started doing the hot and cold compresses on his chest. The doctor said, the naturopath said to me, if you could give him an enema when he had his breathing distress. How do you give a 14-month-old an enema? And I thought, my little Peter loves his elder brother, who's 6 years older than him, his little submarine. And this submarine had a motor on it with a propeller, and he was never allowed to touch it, but he would just watch. So I said to James, James, Peter's very sick, we all know that. I've got to give him an enema. I need to distract him. Can he hold the submarine motor just while I give him the enema? James agreed. So you always work with the will of the child. So we laid Peter down, he's 14 months old. I had the equipment ready. We let him hold the submarine motor. He looked like this because he's never allowed to touch it. And he's looking at James. And then, just as I'm about to put the catheter in, I said to James, turn the motor on. And James turned the motor on, and I could have done anything to Peter at that point. So you see how you work with the child to do it. Do you know that giving him an enema, and I just put the water in, and he held it for maybe 5 minutes, and I had a little pot there, and he sat on the pot, And it brought his breathing distress from 24 hours down to 5 hours, just giving him an enema. That's another water treatment. And we do hot and colds on his chest. About 14 months, he had about 3 or 4 more very serious asthma attacks where this is what I did, and we were able to bring him relief. The 5 hours that he had the breathing distress was very hard, but it got easier and easier and easier. And from 2.5, he has had no more asthma. Now, if you look at the pictures of my sons in the back of the book, he's one of the ones that's got a chest like this. He's very slim. He doesn't look like an asthmatic. He had severe physiological asthma, and yet we're able to conquer it. It's about time. Just when the patient's getting nice and comfortable, you're nice and comfortable, we take the cloth off. And you wrap him up quickly because you don't want him to chill, and you throw that away. And now we have now we apply the ice cloth, and he's looking forward to this. You're not allowed to scream, you're on camera. He's laughing, it's a good sign. But it's actually nice when it's so hot, isn't it? He didn't agree. Never let that chill. And we want a good 30 seconds cold, and that was only about 10, wasn't it? It's good fun, isn't it, Joshua? Yes, it is good fun. And you see why we're doing the cold, because we want that reaction. We want the blood coming to the area. And even with this lovely dark skin, I can see a big red patch on Joshua's chest. Now you dry it, and you must not have any moisture on that skin, because it's the moisture on the skin that could burn. Now that was the hottest pack, the first one I did. His skin's a little bit used to it now, and now that he's had the cold, he can handle it a little bit hotter. So that was the hardest. And here's a strong young man, and I had to lift that about 4 or 5 times. That's all right. That's all right. You've got to work with the person. Now, maybe someone who was in their 50s or 60s, I might have to lift it 10 times. That's all right. That's all right, because you know that after the cold. Now, you see, even with that cold, Joshua's chest is not cold. So now I will not use that cloth because it's a little damp. It must be a dry towel that you put on. Because remember, it's the moisture on the skin that could burn. And that's why I keep putting my hand on to take that moisture off the skin. And the moisture on the skin is basically Joshua's perspiration reacting to the heat. So in a minute I'm going to be moving very fast. I have to move very fast once I've done the, yeah?
So is that still the same 3 minutes, 30 seconds?
That's right. Yeah. Oh, I'm doing it here so you can see. I've got a bit more hot water. So I've got another thinnish towel. Like this. So I dip it in. Boiling water is best. You can always cool it down, but you can't heat it up. And as Joshua can testify, it's hot. Because what you're dealing with is steam. And you're dealing with steam because steam penetrates very deep. And remember, that'll stay hot for a long time, all screwed up like that. So you work very quickly now to keep your heat. It's very hot. That'll keep it hot. I want my woolly. You let me know.
Too hot.
Too hot. Wipe it. Never press. You never press. You just sit it and let the steam go in.
Too hot.
Too hot. You can do this on the spine. You can do it on the abdomen. I'll get a towel. I'm not far. I'm not far.
Too hot.
Remember, it's his perspiration that's coming up, so you want the moisture off that skin. And as you can see from the first one, the point comes when he can handle it.
Yeah, it's fine.
That's fine. Good. Now, can you see that was only 3 lifts that time? Sometimes about this time the patient might like a cool cloth on your head. Would you like a cool cloth on your head?
Yes, please.
Oh, he does. You see what you're doing? You're reading them, you're reading them. Nice?
Yeah.
Oh, nice. See, that gets hot very, very quickly. Because remember your heat. Now this is very, very good training for Joshua because Joshua would like to become a doctor. Isn't this good training? This is the best training. Is that enough?
Yeah.
Is the chest all right?
Too hot now.
Too hot? Now you see I started to read that. He started to move a little bit uncomfortably. That's why you can get more out of reading a person's body language, yeah? And he's being very polite. When he's comfortable and assured that that temperature's fine, I'll put a little bit more water into his hot foot bath. Now you also don't want to burn their feet, so you're very cautious there. Oh, and Joshua's going to get his feet. Oh, thank you, thank you. Okay, back now. How's that?
Yeah, it's fine.
Nice. Do you want that down a bit? Is that better, that like that?
Yeah.
It's a pity in nursing now, the nurses don't get on the ward for a couple of years. You know, the most important thing for a nurse is to read the patient, is to have a lot to do with people. Because I remember coming into a man's bed one day and he was holding the back of the rail, going like this. I said, "Are you okay?" He said, "Yeah." Yeah. He's not okay, is he? Is that all right?
Yep.
And then you get a person who whinges and complains and there's actually nothing wrong, but they're making a lot of noise. So it's just reading what the body tells them. See, I can see he's relaxed now. And when I was overdoing the cool, I could see a bit of a discomfort happening there. So from when he can handle it, then you take your 3 minutes. I'll continue the story of Peter. When Peter was 7, the naturopath contacted me and said, I'm going to be speaking at the Asthma Foundation, and Peter's the worst case I have ever seen. Severe physiological asthma. He said, "I know you're very busy up in the rainforest homeschooling my children with 6 children. He said, just tell me what you did. Because he said, you know more than me now. So I told about the enema, the effect that had. I told about the hot and colds. I told about the dietary changes, the different herbs, etc., etc. He got back to me a week later. He said, I gave the talk at the Asthma Foundation. It was in Coffs Harbour. He said they were very resistant at first, but he said they relaxed and started to listen and became interested. And at the end of the meeting, a lady came up to me. She had a little 7-year-old boy. And she said when this woman was explaining or describing her son's asthma, he said it was as if she was describing Peter. Early severe physiological asthma. You see, my sister and my father both had asthma. So Peter had got it in his genes. He said the child's 7 now, the child has cortisone every day, a glycerin enema every second day, and the child's been given 2 weeks to live. He said, and look at Peter. Oh, that was very confronting for me. Oh. Most people don't go with the alternate way because they don't know it. They don't know it. And you can see this is taking a bit of work, isn't it? In fact, there's, in the little book that you're going to get tonight, Ministry of Healing, there's a wonderful passage in there. It says that nature's process of healing and upbuilding is gradual, and to the impatient it seems slow. The use of natural remedies requires an amount of care and effort that many are not prepared to give. But in the end, it will be found that nature untrammeled does her work wisely and well. Peter didn't heal from his asthma straight away. It was 16 months when I started treating him naturally, but from 2.5 he got no more. And he's got very big chest and arms now. He's a very strong, healthy young man. And what are most asthmatics? Their chests don't develop properly, do they? Genetics loads the gun, lifestyle pulls the trigger. And many are sick through ignorance. They don't know. Now, Joshua's looking really comfortable right now. And I've got no more ice in my bucket. I'll just get a bit more. Now, the effect of opening the bronchioles will continue for even 2 hours after the treatment. Joshua's chest is glistening with perspiration. And he's really looking forward to this. I can tell by the startled look on his face. And we want a really good reaction here, so we're going to bring in 2. He might not like me anymore. He's a beautiful piano player and he might not play the piano for me anymore. He's cringing. It's brief, it's brief. See, that is hot now. That's just pulled the water out of his chest. So we're doing this to equalise the circulation. We're doing this to continue that stimulating effect that the cold brings. And you probably notice I'm very kind. I'm probably not doing the full 30 seconds.
Can you tell me, would that do anything, because you're treating him for something that he hasn't got, will that do anything?
Oh, he'll have the strongest chest in the world. No, and of course that's the beauty of it. Let's say you do this to your child and you've actually diagnosed him wrongly. It doesn't matter because you're working with the body. The body can heal itself. But it's the most powerful treatment on the planet. No drug will do this. So sometimes people say, oh, natural remedies are slow. This isn't slow, this is quick. This has a dramatic effect, very quickly.
How often would you do this?
Now, if someone had a very severe asthma attack, remember I said if you do this, this will, the effect of this can continue for up to 2 hours. So if the person's severe, you might do it 2 hourly. If they're not severe, you might do it 3 times a day. If you did this at night and put them to bed with onion poultices on their feet and gave them some onion syrup and only gave them light soup at night, they'd usually sleep through the night and you'd have no trouble in the night. So we're putting on the next. I was asking everyone, I don't want the nice big fluffy towels. I want the little thin old towels. Because the big fluffy towels, they're They don't work. So we're putting on a dry hand towel, and we're doing our next one. The best way to do this, and as you can see this is pretty powerful, is wool. So what I did at home, so one of those cream woolen blankets, I cut it into 4 and I used the wool. The wool holds its heat longer, but this is certainly holding it long enough. And again, you can do this, you can just wring out wet towels and put them in a microwave, I hear, but I don't have a microwave. So that would probably be a simpler thing to do. What it's good to do is, even on a rainy day, get a few of you together and practice on each other. Because in a crisis, it's a very hard time to do it then. We'll do it here. So you work very quickly now because this will cool very, very quickly. But Joshua can testify that it hasn't cooled down hardly at all. And we carry it to the room. Put it on. Put the wool on. The wool's the best. And then wrap it up. And watch Joshua closely. All right.
Excuse me, Barbara. So while you're doing this process, you've always got to speak in the bucket and hot water. It stays there continuously, like
Yep.
even while you're doing the cold press.
Yep.
What does that effect have?
Well, the hydrotherapist's number 1 rule is warm the feet. Warm the feet. You warm the feet, the whole body's warm. So when that's happening, he's not going to get chill even from the cold. You just keep the feet warm. The feet are a reflex for head, chest and abdomen. So feet being in hot water just helps to cover those areas. All right? See, the third one he's handling. Haven't had to wipe it at all. That's good. So this third one is actually the most powerful, and usually they can handle it because their body's used to it now. But remember that steam penetrating through opens those bronchioles, breaks up congestion, increases the blood supply to the chest area. Very nice on the spine. You imagine how nice this is on the spine if someone has a sore back, a painful back. But the quote that I just gave you, nature's process of healing and upbuilding is gradual. To the patient it seems slow. Impatient it seems slow. The use of natural remedies requires an amount of care and effort that many are not prepared to give. That's why this is a lot of work, isn't it? But all you have to do is have it handy, and it's not that hard. You just have to have this stuff here.
Is it important that they're actually on a flat bed, or can they be sitting in a lounge, a lazy boy chair?
Well, it's difficult if they're sitting because it'll try to fall down. You really want them totally flat so that it goes on the chest. Do you want cold there?
Yes, sir.
Now what we're going to endeavour to do tomorrow is demonstrate the sodium bicarbonate wraps. And that's the treatment that we do specifically for cancer patients to alkalise the tissues, because cancer loves the acid environment. Very cold because his head's quite hot. So this whole treatment really heats you up. No, that's a bit difficult to do it then. Just make sure that their feet are warm.
When would you do the back instead of the kid?
Spine. Now what you can do too, I didn't do it here, and you're best having a wool compress if you do this, is before Joshua lays down, I get a hot compress, like I've been doing on the chest. I lay it down and he lays on that, and that just remains there for the whole time I do the hot and colds. But I didn't do it because you really need wool, because wool will keep that heat longer. Right? Feet hot enough?
Barbara, who practically will do all this? I mean, the GP's not going to do it.
GP's not going to do it. The only people that will do it is you.
Ordinary people and lay people.
Yeah. And how I learnt this, I've never had any training in this. I was up in a rainforest. My children got the little bits and pieces, and I was just beginning to discover books that show you these things. And I got a book of Dr. Kellogg, had the water treatments, and really I had the book like this, and I'm trying bits and pieces, and that's how I worked it out, by doing it on the children. And different people heard about it and they would ask me for help or advice. In fact, I got the nickname Earth Mother up in the rainforest. And then the little church I went to, I said to them I'd like to give meetings. And how that came about was interesting, because every morning I would say, Father in heaven, what can I do for you? And I'd always get the impression, your children, train your children. And then one day I'm saying, Father in heaven, what can I do? And I got this impression in my mind, give meetings, demonstrate how to do this. And I got quite excited. So that next time I went to church, I said to them at church, I'd like to give meetings. And they said, sounds great, we'll do it on a Saturday afternoon. And so that's how it started. That was 1992. And I would demonstrate on my children, like I'm demonstrating on Jeremy and Joshua, because they were used to having all these bits and pieces done to them. And that's how I started. And that's why I say, maybe have a little group together, a few of you to get together and do it on each other. It is just so powerful. And yet there are no side effects like many medications do have. So this takes a bit of work, it is true, but if Joshua was having an asthma attack, after this he would have relief for several hours. And at the same time, the onion on the feet, and at the same time the hot peppermint teas and the flu bombs, and all of that comes together. And if you're doing all of that, you may only need to do this once or twice a day. But the effort is far worth the reaction that you get. And see, the hot and colds I did, that is so easy. That's an easy one. The wet sheet pack, that's a little bit of work, but then there's other things you can do. But if you've got a baby that's very hot, that's where I find it's great, because the mother can huddle the baby wrapped up in the wet sheet and the wool. The only time you got trouble is if that wet sheet gives exposure to air and you get chill. Yes?
So anybody with emphysema once again, that could help him?
With what?
Emphysema?
Oh yeah. Oh yes. The person with emphysema will love you if you do this to them. Brings a lot of relief. So you might practice on each other, and then just find someone with emphysema and say, do you mind if we do some water treatments on you, and go to their home and practice there? But you see what I did, you just watch them carefully and you put a dry towel down between every hot compress. And again, if they've got a microwave, that's much easier. Roll up the wet towel you've wrung out in the microwave, and you just wipe the skin. And can you see that those first few were very hot, and your patient will tell you, I can handle it. And that's why I said to Joshua at home, I said, you're not allowed to be brave. You must tell me if that's, because I don't know. But as you can see by the third one, it's easily handled. And that's why being your own doctor, you've got to listen, you've got to watch, you've got to interpret. So what the gentleman just said is, this is a lot of work. But practice makes perfect, and have your equipment in the corner and practice on each other. And I see my son Peter today. He's a testament to how no asthma, severe physiological asthma, and yet none since the age of 2.5 because of these natural treatments. That's worth it. That's worth it. I meet people who are still getting asthma and they're in their 40s, 50s and had it since a child. And what they've got now too is the effect of the side effects of the medication. Did you know that 80, 100 years ago every nurse was taught this? And did you know that hospitals had big hydrotherapy units? But because it's labour intensive and because drugs came in, it's just so much easier to give a drug. Unfortunately, that's taken it. You heard of the Sand Hospital in Sydney? Sydney, big 7-day Adventist hospital. They had a huge hydrotherapy unit. They had baths and fomentation tubs and all sorts of things, sitz bars. Unfortunately, that's all gone now because it takes time. And some people say, oh, it's very dangerous working with boiling water. It's very dangerous working with Ventolin. And let's say Joshua had been burnt. We'll just put aloe vera on it and it'd heal. But, you know, if you do it right, he won't burn. It's like people say, oh, be careful, don't let the boy climb the tree, he might fall out and hurt himself. Oh, be careful riding on the road. What about being on the computer and what the violent video games are doing to their brain? Better to be knocked off your bike with a car or fall out of a tree and get a broken leg than the damage done to the brain from the violent videos. You see, we've actually forgotten what's really harming the body.
Your son had this severe physiological asthma, but is it true that that's not the only cause of asthma? People through their lifestyle can
Yeah. One lady had asthma from the age of 5. I said, what happened at 5? She said, we moved into another house and little mushrooms grew in the carpet in the corner of the lounge room. So that lady's asthma came from breathing in mould.
Mold, that's it, it's mold.
See that? So it can come from breathing in mould. And we've got a series at home we show at our health centre called Is Your House Killing You? And one couple, they had twin boys who were 5, and one of the boys, they had to take him to hospital every month with severe asthma. Well, let me tell you the story. They didn't know what was going on, so they got this team into the house and they pulled out the little boy's bed, and the carpet under the bed and the wall had all black mould on it. Now this little twin, there was no mould in his corner. So can you see that it's very important? I usually have my why up there. You've got to find out why it's happening. A common cause of asthma is allergy to dairy. I talked to a man last night who grew up on a dairy farm, and he said that one of his brothers could not handle the dairy and was put on goat's milk. And often the most common symptoms of a dairy intolerance with a child, with a baby, is asthma and eczema. And asthma and eczema can sort of flip one to the other. So you're right, it can be allergies to dairy, that's a common one, to wheat, that's another common one, and also there's a bit of genetics there. Notice with Peter, there was the genetics, but we were having a bit of dairy, so I had to stop all that. And that was the main thing I saw with Peter, and then I had to strengthen his chest. And I remember the naturopath said to me, everything you're doing to Peter, he will be as strong as an ox, and that's true, he is. So this has probably gone nearly 5 minutes. I thought I'd be kind to, because it's nice, isn't it? Very, very nice, that hot on the chest. Sometimes I'm kind and sometimes I'm... Now ideally, after the cold, see that's hot almost straight away. That what is the best thing to do now with your patient is that they have a tepid shower, not hot, not cold, because Joshua's whole body will be perspiring now. Is that right? You're feeling very hot after this treatment. The other thing you can do is you can sponge the whole person down, and I'll demonstrate this with one of Joshua's arms, and he'll probably like it if I don't demonstrate his whole body. So you get a cloth, and we'll get this arm here. And yes, he's very warm, and I just go over and then I dry it. It's all right, Joshua, relax. I'm not going to do it to your whole body. So that, because his whole body will be hot. But I'll just do a full 30 seconds to his chest because this is the last one. And take that heat out. Is there a shower here? No. Okay. All right.
Barbara, when we're talking about mold and fungus before, if you've got fungus or a type of mold, and I can think of something that I've actually got in my garden at home, is that a concern being outside?
No, not really outside. It is a concern if it's outside your window and the mould wastes are coming into the house. That's a concern. Now I'll use a bit of cold water to finish the hot foot bath on the feet. So if you just lift your feet up over there, yep, and he's got nice strong abs so he can, a little bit of a reaction there. Just, that was cold water. There's a towel, you can put it straight down on the towel. And it's over. So it actually doesn't take that long. Okay, you can put this towel around you. Thank you, Joshua. Thank you. So that's how you can do that to the chest. Incredible result. Now, if you go to casualty, you'll possibly be waiting 4 or 5 hours in casualty. And yet if it stayed home and you'd done that, and even though it's a bit of work and a bit of time, it's so powerful. See, in casualty, there's a priority list. You might go into casualty and the nurse will say, we'll see you in a minute, and then someone's just come in, been in a car accident, they're fighting for their life. And they, of course, they have to attend that. And they look there, we can get to them in a minute. Oh, someone's having a cardiac arrest, and it can end up being that you're there for quite a while. So look out for your woolly blankets. Don't throw out your thin old towels. Keep lots of hand towels. You've got kettles, and you can do these simple treatments. As I said, try doing it on each other. Get a little group. Get a box that you've got all your stuff in, and it has a very powerful effect. And you can even start at home by just doing hot and cold finger baths or foot baths. So thank you for your attention. Look forward to seeing you tomorrow, where we'll be doing another more intensive treatment on which is the sodium bicarbonate wrap. So look forward to seeing you tonight. Thank you.